Therapists have therapists. I think a lot of people think that going to therapy is like, but TikTok, like they're like.
Hey friends, it's Jake Cowboys. Welcome to the GPS Limitless podcast, where it's my privilege to sit down with entrepreneurs, athletes, clinicians, creatives, and other aspiring guests from a variety of backgrounds. We reflect on their journey and lived experiences to offer insight so your path can be more straightforward. In today's episode, I speak with Sid, a licensed professional clinical counselor, also known as a mental health therapist. We discuss significant mental health topics facing today's society, the various career options for those interested in mental health, and her specific counselor career path. I hope you enjoyed the conversation as much as I do. Also, a quick disclaimer, yes, Sid is a mental health professional, but she is not your mental health professional. The information provided on this podcast is for entertainment and informational purposes only. It should not be construed or relied on as medical advice. Viewing/listening to this episode does not create a professional relationship with Sid. You should not act or rely on any of the information contained herein without speaking to your doctor. All right, first off, Happy Mental Health Awareness Month. How you feeling today, Sid?
I'm good. How are you?
I'm good. So to start off, what got you interested in mental health?
It might sound like, I don't know, kind of like cliche or just like typical like girl who likes true crime. So I always was watching like Criminal Minds growing up, and I loved Dr. Spencer Reed. And he was like the forensic psychologist, or I don't really know what his position was supposed to be, but it was about psychology. So that kind of is what started like my interest and just kind of like the human mind, psychology. And then I also knew that I wanted to be in a helping profession. There was a time where I wanted to be like a physical therapist or maybe like a nurse. And then I didn't like that. And so I went with like counseling. I know a lot of my friends growing up had been to counselors, and I saw how that affected their lives. So that's just kind of how I got here.
Gotcha. So I know you had transferred colleges at one point. Did you come in originally starting off as that, or did you start off as something else?
I started off as psychology. It was in high school, probably like my junior year of high school, when I was like, I don't think I want to do like physical therapy because I don't like touching people. Like I don't want to touch feet, if I'm being honest. But like I was just I don't know, just kind of exploring all my options, since like at NDCL, they were like very like into like prepping for college. And so that's when I kind of found psychology. So then when I started my freshman year in college, I was a psychology major, and then that was my major throughout my undergrad.
Gotcha. So to become like a LPCC, that's what it's called, correct?
Yes.
Do you need a master's as well, or just a bachelor's?
Correct. So you need a master's. So my master's is an MED in clinical mental health counseling. And so from there, after you would graduate, so you have to have a bachelor's degree in something. It doesn't necessarily have to be in psychology. I know a lot of like the people in my cohort had a bachelor's degree in psychology, but some other people had like sociology degrees. Some people had like a fine arts degree. So you can come from lots of different backgrounds, and then you choose your master's program. So in my case, it was the clinical mental health counseling program. And then from there, you graduate with your master's, and then you have to take like a state licensing test for the state that you'll be practicing in. So you start off once you take that test and pass, you'll start as an LPC, which is a dependent licensure. So that means that for the first 2 years as an LPC, you have to have weekly supervision with an independently licensed supervisor, which is an LPCCS. The S just stands for supervisor. And you have to have at least 2 years of clinical work under your belt before you apply to take your independent licensure test. So I took mine in November of 2023. And then once I passed that, I became an LPCC, which is that licensed professional clinical counselor, meaning I have my independent licensure. A lot of different things come with independent licensure. I don't know how far you want to get into the nitty-gritty of that, but mostly it's just a lot in terms of like documentation, which is like never fun. So I won't get into that, but it's again, just like more independence. Like you have the experience under your belt. So it comes with a little bit more independence and freedom, like in your clinical work.
Okay. So I know like in common, like today's society is kind of all the words kind of get jumped around between like therapist, counselor, psychologist. Where did like for you to see, do you call them clients or patients?
We call them clients. Yeah.
So with clients, like, can they see you directly or do they have to like talk to their doctor first? How does that typically work?
Yeah. So at my agency specifically, like if you're wanting to see a counselor, you have to come in for what we call like an intake process. And so you'll meet with a counselor to do your diagnostic assessment, which is kind of what gets you into the agency. But that counselor who does that diagnostic assessment typically wouldn't be like your ongoing counselor. But anyone can, go to whatever agency they're interested in. You don't need a referral from a doctor to start counseling. It's just all about, finding the agency in your community or the counselor at the agency that has, whatever specialties you're looking for. But yeah, to see a counselor, you don't need any sort of like referral from a doctor, typically, at least like at my agency and most community agencies, I would say that you should be able to get in without any sort of referral.
Gotcha. So what made you pursue that route versus, let's say, a psychologist or a psychiatrist? I know there's a lot of school with some of those.
Yeah.
Different responsibilities too, I guess.
Yeah. So definitely the schooling. And then a lot of it just depends on, or I guess a lot of the difference between like a counselor or therapist. I think sometimes people use therapist as like an umbrella term for counselor, psychiatrist, psychologist. I would say like if I say therapist, I'm using it in the like counselor I guess, position, which would be like that kind of like typically like weekly kind of talk therapy. So I think what a lot of people think about when they think about therapy would be like meeting with a counselor or therapist, like someone that, it's like an hour a week, working towards goals, being able to process, whatever it is people need to process. So not only was the schooling something that made me decide that I wanted to be a counselor or therapist over a psychologist or a psychiatrist, it was also just what my, I guess, role would be and what the relationship would be like with the client. I would say for psychologists, we do have a psychologist at our agency, and she does see like a couple ongoing clients for kind of that like weekly therapy, which psychologists can do. But I would say a lot of psychologists and what the psychologist at our agency does is testing. So she does a lot of like autism testing, intelligence testing, personality testing, and then she's also the consult for anyone who's doing any testing. So me as a therapist, I'm able to administer tests, but we would need to be like then consulting with someone like a psychologist to interpret the results of those tests. So that's her main job there. I know psychologists also do like a lot of research, like scholarly research. And then, so I guess it really just depends for a psychologist, like what their role is. But I know at least in terms of the one that I work with, it's a lot less like clinical work, like one-on-one with clients, and more of that, like consulting and testing and research. So that was something that I wasn't as interested in because I wanted to be a little bit more hands-on. And then in terms of psychiatrists, so those are like doctors. So they go to medical school, they do their, I think like their residency in psychiatry. I don't know if I'm using that terminology correctly. But they're MDs or DOs. So obviously a lot of schooling there. And then, while all of our psychiatrists are great and we work in like a team capacity, they just don't get to see clients as often or as long. So I think typically a lot of the clients are seen, again, typically this isn't for all of them, like, once every 3 months for, half hour to an hour. That's just not something that I typically or personally like. I would like to see them a little bit more often, be able to see them work on their goals and see what progress they might be having. So that the psychiatry world, along with the schooling, and just it wasn't as personal for me as I'd like it to be.
I feel that. So not try to throw shade at anybody, but
No,
is
you're
there
good.
anything where counselors look at psychologists? Sorry, is there anything where like counselors look at psychologists a certain way, or psychologists are like counselors, like, oh, she could do this instead, or why is the psychiatrist always prescribing medicine? I would rather than just work on their goals with me, type thing. Have you had any conflicts with that? And if so, like, can you
Like me personally as a counselor, or seeing like a client having that conflict with the psychiatrist?
Either one or both.
Yeah. I think I feel like anywhere there can be conflict, like between two different like parts of a treatment team. So, we're seeing clients in a different perspective. So I think sometimes I'm like, there might be some times where I'm like, like maybe they should be recommending, like, they come in for like counseling twice a week instead of, increasing something. But again, then I have to kind of check myself and be like, okay, that's out of my scope of practice. I'm not the one, I don't know anything about, prescribing medications or what it might be. But I do think that typically we work well as a team. I think there's always like room to question people, and I think that's normal, and that's like in the best interest of the client, because anytime like I or another therapist might be like, why did this doctor do this? I think a doctor could be like, why did this therapist do this? And it's all in the best interest of the client. But yeah, in terms of, people wanting to be on medications or doctors suggesting that people are on medications, again, it's in the best, interest of the client. So I don't think there's anything wrong. Like if you need a little bit of medication or a lot of medication to get you to a spot where you feel comfortable and you feel safe and you feel secure, I don't think there's anything wrong with that. And if you're doing that in tandem with going to like therapy, I think that's great. And if you're not, I think that's great too. It's all about what works best for them.
I feel that. So for you personally, said, what's your favorite part of your job?
Well, so my job, since I started at the agency, my position has changed. So I was a sexual abuse therapist working with typically children who have been sexually abused. I worked in that position for about a little over a year, and that was really, really draining. So I fell in love with like crisis work. So now my position at the agency that I'm at is an emergency services therapist. So the thing that I love most about that is it's something new every day. You really don't know what you're going to get. And I still see a couple of the clients that I had for like my ongoing, like weekly sessions when I was a sexual abuse therapist. I went from like a caseload of 60 to a caseload of 5, which is really nice. And so now when I'm not seeing those 5 clients, I guess the role of an emergency services therapist, which I like so much, is just tending to crisis. So at our agency, we do have a crisis line that we will talk to clients calling in on that. We also do walk-in services for the community. So you don't even have to be a client to come in as a walk-in and talk to a therapist, like an emergency services therapist like myself or one of the other therapists in my department. We do assessments at the hospital for any child under 16 or any person who doesn't have insurance. So we would be the one assessing them and seeing if they're in need of a higher level of care through psychiatric hospitalization. And then one of my favorites is we also work in our county jail and do assessments over at the jail. So I really enjoy I really enjoy working with the inmates there and just in that population, because that's always super interesting.
Is that like a typical thing for crisis people, or is that just something special to what you have in your agency?
That's a good question. Honestly, I'm not sure what it's like in other counties. So through my agency, we do have a full-time or 2 full-time jail therapists at the county jail. But for some reason, if they're not there that day, or, when they leave, earlier in the afternoon, if there's a crisis going on at the jail, or just if they're already talking with one of their ongoing clients and there's a crisis going on, or if they're out, we fill in for them. So I'd say we probably are over at the jail at least once a week, if those jail therapists aren't available. Otherwise, there's always the jail therapist in the jail. But I do really enjoy the jail. It's something that I think a lot of people might shy away from. But it's really interesting. And you never know what you're going to get there. So I think, long story short, I just like the position that I'm in now because I never know what I'm walking into that day. I might have some things on my schedule, like seeing one of my ongoing clients, or another thing that we do is when someone's getting out of the hospital after a psychiatric hospitalization, they'll do what we call a hospital discharge appointment with us to make sure that they're either if they're already in services, they're getting an appointment with their provider, or if they need services, we get them set up with those. So if I don't have a hospital discharge on my schedule or an ongoing client, it's just I kind of get to see what the day is going to throw at me, which sometimes is a little overwhelming. But otherwise, I kind of like the element of surprise. So that's fun.
Props to you. I'm not the surprise type. But for the crisis stuff, does that mean day of, or does that mean literally on the minute? If it's at 3 a.m., are you the person to call, or does that mean oh, I have something going on, I'll see you at 8 a.m. tomorrow type thing?
Yeah. So it's both. So I would say I have my typical work day where whatever crises there are, we're tending to those. But then we also have an on-call therapist. So they're the ones who do the evenings and the weekends. So that crisis line that we have, if people call that over the weekend, they'll be connected with that on-call therapist. Or if there's something going on at the jail over the weekend, or someone needs to go out to the hospital to assess someone, that on-call therapist will do that there. So it is a 24/7 service. It's just not always me.
Gotcha. So yeah. I know you mentioned some of your favorite parts. And I imagine that there's days that you feel overwhelmed. How you deal with, taking on people's struggles. I feel like there's a lot of people out there that are hey, I want to help with mental health, but I don't know if I can do it for my own mental health.
Yeah. There's been some really rough days. I'm not even gonna sugarcoat that. There are some really rough days, whether it's someone's in a crisis, or a mental health crisis, or in some sort of there's exhibiting like more erratic behavior, and you're getting screamed at by someone who it's because of this mental health crisis that they're having. It's not because of you. Sometimes it's really hard not to internalize that, and being like, oh wow, like maybe I do suck, or whatever they're yelling at you.
Yeah.
But it's important to remind yourself that it's not you. They're just having a really hard day, and you're the person who they're able to say all of this to. And then, being able to have really great coworkers, to talk to about these things, who have experienced similar things, that's super helpful. And then having just like supportive people outside of work. Obviously, I can't share as much with them, to like keep confidentiality, but obviously they know what I do, and I'm able to share some of that with them while keeping client privacy, and so being able to have a good support group outside of that as well is like super helpful. There's also been, going back to like just how important it is to have coworkers who support you. We've lost clients, whether that's to like, whether that's to natural death or to suicide. And that's truly like some of the hardest things that I've experienced on this job. So being able to like have a coworker talk to you and be like, hey, like, we did everything that we could for that person, or, we were able to make them comfortable or whatever it is it's a necessity, truly. So yeah, that's what I fall back on, my coworkers and my other supports in my life.
I feel that. I've heard of someone before, where they have a policy where like, not an actual policy, but just like their own routine where when they're driving back home, once they hit like a certain point, once they pass a tree, they stop thinking about work.
Mm-hmm.
That is like an easy thing to do, or is that something that might just be special to him where you can do that? Do you ever find yourself at home and just like, man, I just can't let this go?
Yeah. So I have poor work-life boundaries, and so that's something that I'm trying to work on myself. There was a time where I was like constantly like checking my emails like on my personal phone. So I've taken that email app off of my personal phone, and I only have it on my work phone. And my work phone just stays in my bag like all weekend or like at night. So that's one way that I try to, keep work at work. Another way that I try to keep work at work, is that on-call position that I was talking to you about. So that's something that people sign up for, and obviously there's like incentive pay and stuff. That's something that I have yet to sign up for because I'm still working really hard on those work-life boundaries. Because a lot of it's like, okay, when you're at home, like on a Saturday, you're taking these calls from our crisis line. And when I'm like, okay, this is my home environment, I don't want to be thinking about work. So my colleagues that I have who do the on-call stuff, they're like the best of the best. And, maybe someday I'll be at that spot where I can still like, do some work at home, through the on-call. But right now that's just not for me. I'm taking my baby steps, kind of like what you were talking about. Like, you pass this tree, you stop thinking about work. It's really like when I pull out of the parking lot of the agency, I'm like, okay, we're done. I'm not checking my email on my work phone. Like, we're going home. I need time for, self-care, relaxing, just kind of rejuvenating from whatever it is the day threw at me, especially on the really hard days. So that's kind of what I try to do. But I do know that a lot of people kind of have like those, routines, like I'll give myself this amount of time at home to like think about work and just to like kind of give myself some closure, and then I'm done at 5 o'clock or whatever it might be. So yeah, I do think that is really helpful because it is really important to maintain like those good work and then life boundaries, because otherwise I think you're going to get burnt out really fast.
So mentioning like burnout, do you think there's any qualities that like you absolutely need to have if you want to be a mental health therapist, or is it kind of like can I'm not to downplay the job or anything? Is it more
No, you're
so
good.
a lot of people can do it, or is it you really need to be able to tap into this trait, this characteristic, whatever?
I'd like to say I think a lot of people can do it because I do think like the main part of the job is caring. And
Mm.
I'd like to think that most people are able to care about people like that aren't, themselves or their family or friends. And if people aren't able to do that, then maybe it's not for you, and that's okay. I would also say it is important to like be able to not only just talk but also be able to listen, because while a lot of my job is talking with people, it's also just listening, and then being able to like truly listen. So like one of the things that they taught us in grad school is like, reflecting meaning or reflecting feeling. So you got to make sure you're actually listening. So when you reflect that feeling, the client is like, okay, like they're understanding, because that's also going to like form that therapeutic relationship. So I'd like to think that, again, if you're able to care, and like empathize with people, and you're willing to listen maybe more than you're willing to talk, I'd like to say that people could, a lot of people could do this. Now it's maybe a lot of people could do this. I don't know if a lot of people would want to do this, because you do hear a lot of difficult things, and you got to make sure that like you have those supports in place. So when you're having, a rough day from hearing about someone's absolute worst day of their life, you have people to talk to about it, and they're also going to be the ones to just like check in on you like a week later and be like, hey, I know that you had a rough day last Wednesday, like you good. So it's really about like the supports that you're able to either like gain on the job or the supports that you already have. But I encourage people, like if that's something that they're interested in, to like at least give it a shot. I don't see why you wouldn't be able to give it a shot.
What would be like the first step that you would tell someone like they're, let's say, about to graduate out of high school, they're like, I want to be a LPCC. What would
Hmm.
you say is like the first step that they should do? Should they like get some observation hours? Should they do
Yeah.
some research or
Uh, I think observation hours would be great, but also like for the people who live in communities that have like the kind of like walk-in sessions, like I do, like my community or my agency does, or they're able to like call and talk to a therapist, like try that out. Like go kind of see what it's like, what it might be like in therapy, like if you've never tried it before. Or even like you said, like observation, like sometimes it's hard to be able to do observation like in this field, because so much of it is like confidential, and it's hard if you're not like an intern, like at the agency, because we have a lot of interns who will shadow like different, like whether it's groups or like those diagnostic assessments, like the intakes that I was talking about.
is it intern during college or is that after you graduate?
So that is the interns that we have at our agency, at least, are it's part of their master's program.
Gotcha.
So I would say I know that there are other places that have interns, that might not be like in like their graduate program. I think it really just depends on the place and like the protocols and policies, for that. But I do think observation is really helpful as well. But also just like living experience, like talking to a therapist yourself and seeing like, is this someone like that I feel like I could be? I think that would be really helpful. I know I watched like along with the Criminal Minds, which is not a good accurate representation of what I'm doing now, but like I did watch like a lot of like different like TED Talks, different videos on YouTube and stuff, just about like counseling and mental health in general.
Gotcha, gotcha. Is there anything setting wise where like your agency, how you said like works with hospitals and like counties and stuff? Are there
Mhm.
settings that LPCCs work in, or is yours pretty much like the standard?
Oh, yeah. So my agency is a community agency. So we're very involved in like different like county organizations or agencies, facilities. So like the jail, like the hospital, like Jobs and Family Services, we work a lot with them. We work with the courts a lot. I would think that, if you're going to be a therapist in like a private practice setting, so at least what I've seen is you're serving like a smaller population, because I think with a lot of private practices, they don't necessarily accept like insurances like Medicaid or Medicare. Some of them do, but a lot of them can be like self-pay. So in like a community agency like I'm working in now, it's really like about serving the community. Not that a private practice isn't, but it's more like it gives more opportunities to maybe the people that aren't able to afford it. And sometimes the people who aren't able to afford it are the people with the like higher acuity needs. So like the more severe forms of mental illness. And I would say another place that I know a lot of like therapists, LPCs, LPCCs can work is like in a hospital setting, like so that inpatient, like psychiatric setting. They do in the hospitals. I know that they like while someone's hospitalized, they do like a lot of groups. They do individual counseling to kind of help stabilize the person while they're there and to set them up for success when they're discharged. So I'd say those are a couple other settings that therapists are able to work in.
Gotcha. And one of my biggest questions, I'm sure a lot of people have it too. Do therapists have therapists, or do they just handle it themselves?
No, therapists have therapists. And I've had clients ask me that too. Like, I remember I had like this 13-year-old client, and she was like, there's no way that like you're ever anxious. And I was like, girl, like, I can be anxious, like therapists have their own therapist. I don't personally have my own therapist right now, but I did. Like I had a therapist for a long time, and I had a therapist when I started my job, and I kind of was able to feel comfortable enough to phase out of that. But I know that there are plenty therapists that have therapists. One of the really great things about the agency that I work at is we have a therapist whose position is called a wellness therapist. So she's the therapist for the staff. So you're able to meet with her, because we hear a lot of like rough stuff, and you need to talk about that. And if you don't necessarily feel like you have the outlet, or maybe you've never been in therapy before and there's other things that you need to process and discuss, from your past or things that are currently going on, like therapists need therapists. I would say like, a doctor still needs to go to the doctor, like if they break their bones. So yeah. Therapists still need to go to therapists. And I think that's something that's really encouraged in our field. And luckily my agency is a place that's really encouraging us to seek out help if we need it.
Gotcha. I feel that. So, speaking about therapists having therapists, I kind of want to switch the gears here, moving away from like the career path stuff, but more so having a more conversation about having a conversation about mental health in general. So a lot of people, we talk about mental health this, mental health that, and I feel like there's a lot of stigma around it, right? And there's also people that don't take it as seriously because we just say mental health. What are your thoughts on calling things mental health versus mental illness? Like I feel like mental illness gets people's attention more, but at the same time, since it is already kind of a stigmatized area, that mental illness title might like push people away from wanting to talk about it. I just want your thoughts on it.
Yeah, no, and that's a good point. Because like even in our field, like I think when I was talking before about like people with more severe like mental illness, like that's a term that we use quite often. Like we have, just kind of have that in our vocab. But I would say just kind of in society, I do feel like it's almost like a double-edged sword, like mental illness. Like if people already aren't taking like mental health seriously. Like mental illness makes it sound like, okay, this is just like an illness, like people have physical illnesses. So like maybe that's like something that would make someone take it more seriously. But then also, you know, if there's that same stigma around it, calling it an illness is almost like some people might see that as like a vulnerability or like a bad thing. So in like the like mental health field, we always joke that like we always say it depends. So that's kind of what I'm going to say with this, like it depends, which is not always a great answer, but like I said, you can kind of look at it both ways. Like it can make someone take it more seriously or make the public take mental health more seriously by calling it mental illness, or it might also kind of it could stigmatize it more by saying like it's a vulnerability. So I guess I don't have the best answer for that one. If I always say, you know, I like to use like people first language. So I'm not going to say like a mentally ill person. I'm going to say like a person with mental illness. So like I myself, and I know most people in the field would never use mental illness as like something to tear someone down, more just to describe something that's going on with someone and being able to, you know, from there figure out a course of treatment. So that's why I would say that.
So have you ever had, I know I said talking more like general, but this is kind of general, kind of not. But have you ever had like anyone come in that is very set on them being diagnosed with something? Like they were like, hey, I looked at WebMD, I for sure had this. What are your thoughts on people like self-diagnosing themselves? Like, do you think that can be helpful, beneficial? No, no.
Jay. Oh, Jay. Yes. So I love social media for how it can be so unifying for people who might be dealing with things and, you know, maybe people in their life, they can't talk to people about it. So I think social media is really great for helping someone know that they're not alone. But also, I think the other side of social media right now, I think there are a lot of like buzzwords that involve mental health that are going around like social media, like TikTok in particular. And I don't know if I said it before, but so when I was in my first position as the sexual abuse therapist, I was working with primarily children. And now even as an emergency services therapist, I still, not a lot of people in my department always want to work with the kids or teens. So like, I still try to do that because I just enjoy working with that population. But TikTok, like they're like on TikTok and they'll come in and they'll be like, oh, I'm so manic today. And I'm like, oh boy. I was like, let's talk about what that really means. So I do think that there is some, maybe like overgeneralizing like a certain symptom, and, you know, then identifying with, you know, a certain, diagnosis that may be associated with. And then, you know, sometimes it's easy to make a diagnosis like your identity is, and I'm just speaking from, you know, what I've seen. This isn't for everyone. So like if you're making a diagnosis kind of your identity based on one symptom, but you don't necessarily meet criteria for that, like it can be difficult. Or like if you are trying to help someone like with treatment for like, you know, a diagnosis that they've meet criteria for, or they've done testing for, and they're like, no, I don't have that, I have this. Sometimes it can just be difficult for a course of treatment. So again, I do think like talking about mental health on like social media and stuff is super helpful. But I also think there can be some things that make it a little bit more difficult, like as clinicians. I don't know if that answered your question or not.
It kind of did, it kind of didn't, but I do like the way that you took the combo.
Okay.
Kind of keeping it with social media, just in like a general perspective, do you think it's been helpful to like people like in general? Like I know that you work with teenagers a lot, but I know sometimes people are like, oh, it's bad to compare yourself to other people's lives, but in other things, like you mentioned, can be like a unifying source. So,
Yeah.
like, if someone, this is just a general thing. Once again, this is not medical advice, people, but if someone's like, hey, I'm having this feeling, do you think it's beneficial or not for them to, like, be on social media at that point?
Mm-hmm. Again, with our fun little phrase of it depends.
Yeah.
I think it really just depends on how they're utilizing the social media. I think if, like, I always like to tell people, if someone comes in and they're like, I'm feeling anxious, I like to tell them, I'm not invalidating what you're feeling by saying a lot, or at least I'm not trying to invalidate what you're saying by, saying that there are other people who feel anxious too. So I think that can be like comforting to know that you're not alone. Again, like being on social media, like if you don't have the supports, I think it can be really helpful, but also being on social media can be like, I think it leads to a lot of maybe like self-diagnosing where you don't need it, or maybe just like exacerbating symptoms. But I tell people, at least like for like teens, at least, like I work with the parents a lot too, it's not my decision, if you're limiting like your child's social media use. Like that is completely up to you. I can tell you, or maybe I can recommend to you, some things that I've seen, and I can, whatever the client is feeling, like, I'm gonna meet them where they're at. The same with an adult using social media. Obviously there's no one there to monitor them. So, if you're using social media and, maybe it's not the best, for, whatever it is that you're dealing with, I'm not ever going to make a or I'm not ever going to be able to force anyone, whether I wanted to or not, to stop using social media as a way to either, like feel a part of a group, or like to, kind of validate what they're feeling. Whatever they bring to me, like I'm gonna have, like, we're gonna sit with it, and I'm just gonna meet them where they're at. So if social media maybe isn't like the most helpful thing, I'm not necessarily gonna be like, hey, like, don't you think that this is making things worse? I'm kind of gonna, like, part of therapy is just like allowing them and maybe kind of guiding them or directing them to get to kind of where they need to be. And so kind of like helping them, open, or like if they're willing to be open to like, hey, maybe I need to think about like how this is, like, being on social media is affecting me. I'm going to help them get there if that's where they're allowing me to like help them get to. It's really all about what a client is open and willing to express and experience and process. I think a lot of people think that going to therapy is like, okay, the therapist is going to give you the advice. And I've had to tell a lot of people, like, no, that's not my job. My job is to sit with you and to allow you to process and to maybe challenge you on some things, but to ultimately give recommendations and guidance and be a listening ear for when you need. I'm not going to give advice. Like, I'll give you coping skills, like if we need to talk about coping skills or recommendations, but therapy, I think we've really moved away from it being advice giving, because that's just, I just don't think that's practical anymore.
Gotcha.
Mm-hmm.
I feel like sometimes, there's people that are kind of on the fence of whether they should seek professional help or not. What do you think is like the deciding factor to be like, for the most part? I know it depends, but like for the most part, hey,
Now I got you on it too.
or is it more so of I have a friend, they'll listen to me, that's good enough,
Mm-hmm. Yeah, I mean, my thing is, why not just give it a shot? The worst that can happen is that ideally, the worst that could happen is you don't like it and then you just don't go anymore. So I would say, if you're thinking about it, like on the fence with it, just give it a shot. I think some things that really push people, like who might be on the fence, at least what I've seen in my experience, people who might be on the fence, what really pushes them to get into therapy. One is maybe they start feeling or thinking things that they've never thought of or felt before, and that scares them, which is completely understandable. So they're like, okay, like I got to do something, like I really have to change, or maybe not change, but we got to figure this out. So that will kind of get them to come in. I also think just having like good supports and like people who know them being like, listen, like I'm concerned about you, or I think, you know, I think you would benefit from talking to someone besides me being, that person's friend. But I think a lot of what I've seen is either like friends or family supporting them or encouraging them to come in, or them getting to a point where they were like scared of what they were feeling or had never felt that way before. So yeah.
If someone is kind of like at that point where they're feeling those new emotions or whatnot, how would you recommend that they come out and tell, their loved ones what they're feeling? They like don't really talk about mental health like that.
Yeah.
How do you think they should go about that conversation?
I mean, there's so many ways. Like it can be, I completely empathize with how difficult that can be for maybe people who have families or friends who like don't believe in mental health, or just like aren't really open about, more vulnerable or sensitive things. And I've talked with people, and mostly like through the crisis line, who are feeling this way. And there have been a time where we do like a 3-way call, and they're like, hey, I've done this actually a couple times. Like they're like, hey, I'm on the phone with the counselor right now. Like I'm having this issue, but like, I don't know how to talk about it. Or like, if someone comes in for like a walk-in and like brings a family member, like if they're willing to take that first step of like seeking out help through like a crisis service or getting in with a counselor, we can also be there as therapists to kind of help mediate that conversation or direct the conversation. Or, if I've done this too, if I'm like, or if someone's like, I don't know what to say, I don't know how to say it, I don't want to say it, but I want them to know, I'll be like, okay, like we can sit together and I'll tell them for you and I'll talk about it, and I'll, kind of open that up, like break the ice so it can be a space that they can begin to discuss that. So yeah, I mean, I can't imagine how difficult it must be for someone to bring up to loved ones who maybe either don't believe in this or are just not very open to like mental health. I can't imagine how difficult it must be to bring that up. I would say, if you're not able to kind of do what I did and like talk with the therapist and have that therapist maybe kind of open that door, if there's anyone particular in your life, even if it's like a coworker that maybe you're not as close with, but you feel comfortable talking to, just kind of like run it by them, be like, hey, I'm kind of looking to talk with people about this. Like, what do you think? Like, again, it's all about what a client or a person is comfortable with. And, if they're not comfortable with it, but they want to be, then I would say, talking with a therapist like on their own, and then kind of just like taking steps towards being able to talk with a family member about that.
I feel that. I like that a lot. So I think that's most of what I want to talk about. I really appreciate the work that you do and everything, and I really value mental health here, and we really value mental health here at GPS. I just want to give you the floor if there's anything else that you want to speak on mental health wise that you think people should really know.
Yeah. I know it might sound cliche. You probably hear it a lot, but it truly is okay to not feel okay. And you're not alone in this. There are a lot of different agencies who can help people with mental health, regardless of like financial needs. I know a lot of different county boards, like at least in my county, like our Board of Mental Health and Recovery Services will like fund mental health services or addiction services for people who aren't able to afford it. So I would say reaching out to your local county board. A lot of counties have NAMI, which is the National Alliance on Mental Illness, and seeing what resources that you might be able to receive through there. There's also, if you're in need of talking, there is, like you need to talk to someone about whatever is going on in your life, even if you feel like, other people out there might have bigger things going on. Your feelings, your experiences are valid too. You can reach out to the crisis text line. You can text HOPE to 741-741, or you can call the number 988, which is it's the new emergency line for crisis. It used to be the suicide hotline, which was like a longer phone number. They've shortened it to 988, and they'll get you connected with a mental health professional in your area. So that's what I got.
Sid, I really appreciate your time. I'll go ahead and leave all those links and resources that Sid mentioned in the description, or if you're listening to this on podcasting, it'll be in the show notes. Once again, thank you for coming on to the show, Sid. And if you have anyone that has helped make your path more straightforward, we always like to give a GPS shout out. So do you have anyone that has helped you, on your path to becoming an LPCC?
Yeah, I would say the biggest group of people who were able to help get me to where I am are all of the professors at Kent State in their clinical mental health counseling program. One in particular, his name is Dr. Jason McLaughlin. He actually passed away last year, but he did amazing work on like suicide assessments, crisis work, and so that's really shaped me into, the emergency services or crisis therapist that I am today. So all of the knowledge and help and support that I got there, I wouldn't have been able to do it without those professors and without Dr. McLaughlin especially.
Gotcha. Shout out to those professors and Dr. McLaughlin.